Hi, my name is Coral. I'm going to teach you how to use the medication Meriofert or Fostimon. You may have different dosages, and here I'm going to show you Meriofert 75. So when you open the box, there will be a powder, that is the drug, and a saline water, which is a salty water. We need to put the water into the powder and then do the injection. So first of all, if you take the lid off everything, so if you remove the cap with your nails, and then I need to remove the cap of the glass vial. So if you give it a flick, all the liquid will drop down, and I'm going to use this snapper to take the lid off. So if you use the teeth of the snapper and press it over, and then you can snap the glass vial. And the glass is quite safe in there. To do this injection, you have an empty syringe, a long needle and a short needle, and I'm firstly going to use the long needle to mix the two together with. If you just pull the two apart, I'm going to put the long needle into the water. I'm going to tilt it at 45 degrees and put it in the right bottom corner and just draw it all up. This is now empty. This should be disposed of in a sharp spin. Now if you lose any of the water, this does not matter, as this is just water to inject the powder, which is the drug itself. I'm going to take the long needle and go straight into the rubber in the top and inject all the liquid into the powder. It should dissolve instantly into a clear liquid. If you wish to give it a little swirl, you can do like that. Now, using the same syringe and the same needle, I'm going to tilt everything at 45 degrees, pop it in the bottom corner and draw it all back up and remove. Now this is completely empty and will also go in your sharp spin. Need to take off the long needle now, so I'm going to safely take that off so I don't catch my fingers and twist it off. Keeping the tip of the syringe clean, I'm going to remove the small needle from the packaging and put them together. And take the lid off this by pulling them apart. And now I'm ready to do the injection. There is some air at the top here that I'm going to remove by just pressing up until a drop of liquid comes out the top. There is a small air bubble here that is completely safe. So to do the injection now, I'm going to expose my tummy and go below my belly button by a few fingers and inject here. You need to avoid any bruising or any moles or scar tissue. You're going to pinch the skin, have the needle facing you and go in straight. The needle will go in all the way and you will then press on this plunger. You can also release the pinch and press with this hand if you need to. The whole amount of medication will be injected and then you will remove the needle and the injection is done. This should all be discarded with in the sharp spin.